Hey everybody, Revive Spine and Sport Physiotherapy and Chiropractic Clinic. I'm Dr. Shane Samuel, chiropractor.
And I'm Girish, physical therapist. And today we wanted to talk about a few things you can do at home to minimize your low back pain or to help with you getting back to getting pain-free. These are some simple things you can do on a day-to-day basis that can actually minimize the stress in your lower back and help pave the road to your recovery.
So just to be able to go in addition to what Dr. Girish was saying here is if you guys take a look back at our previous video on low back and sciatica, you'll understand that there's a framework, there's a groundwork that we have to start with, and that's always from neutral position. And what we want to be able to do to be able to minimize the amount of pain that continues with low back pain and be able to heal as best as we can, we need to be able to minimize the amount of micro movements that potentially could be bothering and irritating your lower back. That could be creating that leg pain. So yeah, like as Girish said, he's going to go through some different stretches. So what can I do kind of, maybe if I'm getting into bed, how can I do that?
So before we get into that, could you demonstrate what neutral position is?
Oh yeah, of course. We can go over that again. So neutral position is when the pelvis and the rib cage are in line. They'll give you a better ability to be able to breathe so that the muscles of respiration are able to coordinate better with the core, and that really helps with back loading. So what we'll actually do here is we'll see that there's, so you can see that he has an angle here of his pelvis, an angle here of his rib cage, and they converge with each other, correct? Now, overextend. Now these two, they open. This is called open scissor, and they actually diverge. So this is also going to be bad for your back. So what you're actually going to look for is ear over shoulder, shoulder over hip, hip over knee, knee over heel. So we're going to want that good relationship while we're moving, and especially when we have load. So that's why it's really important to have a bit of a strategy when we're coming to organizing ourselves when we're going to move. So how do we get in and out of the bed?
So
tell me how to do it. Actually, show me, coach me.
So how would you normally do it?
So how would I normally do it if I was in pain? Yeah. I'd probably do something along this line.
Okay. So the way you were doing, I mean, it's quite normal when we are in a lot of pain for us to get into this fetal position. You know, we want to curl up. But what happens when we get into that position is there is too much compression that's going on in your spine that can exacerbate your pain. And you do that like 5, 10, 15, 20, 500 times a day, then it all adds up and it can sensitize the structures which are already sensitized. So the main thing that you need to watch out for is when you're going through movement transitions. For example, when you're going from a standing position to lying, standing to sitting, you want to get back to the neutral position that Dr. Shane was talking about just prior to this. So if you can, just make sure that you maintain a neutral position throughout and go back to a lying position.
Okay. So what would you say? How would this work here if I were to?
So that's like really good. So he's got a pretty solid base here. That's something to consider. And then he didn't lose his curvature when he sat down from a standing position. And then if you can just do the same thing, just maintain a neutral position, take all your weight on your hand and use some momentum through your legs to lie down. And that was perfect. And same thing when you're standing up from
just
a
reversing from the lying position is just the opposite. So I'd be putting my hand here, nice neutral core, strong core, come forward, wide base.
That is perfect. One of the things that I'm pretty sure it's the same case for you too. One of the things that most of my patients have difficulty with is picking up not heavy objects from the floor, but like a key from the floor or a pen from the floor. Okay. And often they hurt themselves doing that. They say, my back was fine until then. bent down to pick up a pin, and then I had severe pain in my back and in my leg. How can we avoid that, Dr. Shen?
Okay, so what we'll do, we'll utilize this green ball here. It's very lightweight. We'll just put it on the ground here. What we'll want to do is we'll want to be able to try to organize ourselves in the best way so that we can actually minimize the amount of extra movements from neutral to be able to organize ourselves to pick that up better. So what we'll do is I'll have you, Girish, come over here, just square up towards the object, wide base. Yeah, that's actually perfect. And what we're going to do here is we're actually going to utilize the golfer pickup, and it's going to utilize different leverages to create strength through linkage. So what we want to be able to do here is he's going to utilize that same principle to be able to hinge with the hip, but he's going to use one leg and put his hand on his thigh and reach down in front of him and hinge up to pick it up just like that. Now, not a whole lot of movement in his lower back while he does that. The slower you go, the easier it's going to be for you to be able to stay in control. If you're loose and wild, you're going to have some issues, and that might not be a good time for you, especially if you have a flare-up of back pain.
And something I always tell my patients, my older patients, is if your balance is not that great, is to hold on to something. Like if you have like a broom, or hold on to a furniture or a chair, and you pick something up from the floor.
The more points of contact, the better.
Yes.
Essentially, right? So I guess another thing that my patients actually deal a lot with is tying their shoes.
Yes.
So how would you say we would go about doing that?
So again, following the same principles of neutral spine position, what I tell my patients is to put their foot up on something, and make sure that their spine is still in a neutral position. Lean and lunge forward all the way, so that so your leg is taking all the weight instead of your back, and then you can tie your laces. Same thing, putting on your socks or putting on your shoes. So this is something that can be easily done, and there is minimal stress on the low back when someone is doing that.
Depending how tall you are or how flexible you are, that may actually change the height of whatever you're using, the step stool that you're doing. Because if some people may be able to go really low, some may have to go really high. You're really tall, so. Anything else? Any other movements that you want to go over that are very common?
How about picking up a heavy
object?
Yeah.
Okay. What we can do here is we'll just simulate with the crate here. And do you want to coach me through this? I'll show them how to do this. So what we'll do here is I like to start this off. Anytime you can go a little bit wider stance, you're going to be able to handle more weight. First checklist I go through in my head when I'm about to pick something up is, can I get closer and can I get into a neutral position? So again, hips and your rib cage in a good position like such. I'm in front of the box. I guess what's my next drill here?
Make sure that you're using a hip hinge, and mostly put all the weight on your legs. Make sure that you're still in a neutral position like we discussed before, and then try to get as close as to the weight as possible without losing the curvature in your spine. And if you are losing curvature in the spine, then you've gone low enough, and it's not appropriate for you to lift that weight. And if you can just demonstrate that, Shane.
Yeah, you bet. So what I'll do here, organize my spine, wide base, turn the core on, bend from the hips. I'll run out of room, so I eventually have to start bending the knees, but everything is still in front of me. I have a straight back. Hold on to it, keep it nice and tight to my body, and use my hips as I come up, right?
Perfect.
And the same thing, lowering it back down. It's the same movement. You should be able to reproduce that over and over again. I think what we'll have to do is we'll have to build up an entire in-depth video of what a hip hinge is, because this can be kind of a confusing, and sometimes it's a practiced type of a movement because we're so used to the classic tip of bend with your knees or lift with your knees, and I think a lot of the time that runs people into trouble because they end up using their back more, because that's just the way that their body is trying to escape the pain, funny enough. Wouldn't you agree?
Yes, and I think following this, we are going to make some videos on how to do yard work, how to vacuum, and I think those are areas where my patients tell me they've had a severe exacerbation of their back.
Yeah.
And
Well, in a nutshell, that's repetitive overuse.
and you know, we are coming on to the spring season, so I would advise you guys with back pain to pace yourself. Make sure that anytime you bend over to do yard work, you're not doing it for more than 10 or 15 minutes at a time. Stretch between, stretch as much as you can while you're performing yard work or housework.
Yeah, I can't stress it enough. If you start to get a sore back when you're doing something, you're using your back too much and you haven't taken a break soon enough. So that becomes a talking point of threshold and being able to build up the amount of capacity to be able to handle work over the long run. Anything else you like to add, Grish?
That's it, and I hope you guys get something out of these videos and stay safe.
Yeah, thanks a lot. Take care. Bye.